Have you ever been in a situation or even just thought about, like, if something happens and, it's an emergency, every second counts, right? Now imagine that same scenario, but you're way out in a rural area, maybe miles from the nearest hospital. That's a whole different ballgame.
Absolutely. The stakes are even higher. It's a challenge that many communities face. And sadly, not enough people are aware of the realities.
Yeah, you've got long wait times for help to arrive. Maybe there aren't enough ambulances available. And then you factor in the terrain, difficult roads, or even no proper roads at all. It's a huge issue when it comes to providing timely and effective emergency care.
It really is. And today, we're going to delve into something that could be a game changer, a new initiative called the Emergency Transportation Network.
I'm excited to learn more about this. From what I've read, it's all about creating a community-based system, right? Harnessing local resources to help people faster.
Exactly. It's about connecting people in need with whatever resources are closest and available. Think local transportation, folks in the community trained as first responders, even linking up with healthcare facilities in a more direct way.
And the potential impact is pretty remarkable. I saw a statistic saying it could reduce emergency response times by as much as 60%.
That's right, 60%. Just imagine what a difference that kind of speed could make in a life or death situation.
So for anyone listening who maybe hasn't thought much about this issue, this is your chance to learn about a potentially groundbreaking solution. It's one of those things that blends tech and community action in a really surprising way.
It really does. And for those who do follow this topic, we've gathered a good amount of information about how this whole network came to be, from the initial idea to how they actually launched it.
So our goal today is to break it all down. We want to figure out how this network actually works in practice and, of course, what makes it so effective.
Perfect. So maybe a good place to start is with the problem itself. Why is emergency response such a challenge in rural areas? Because there are some pretty stark realities when you look at the numbers.
Yeah, let's hear them. What kind of stats are we talking about?
Well, first off, think about the time it takes for help to arrive. The average response time in many rural areas, get this, can be over 70 minutes.
70 minutes? Wow. That's way past what they call the golden hour, right? The crucial window for treating serious medical emergencies.
Exactly. And that's just the average. In some situations, it could be even longer.
Yeah.
And part of the problem is just the sheer lack of resources. In rural areas, there's often less than one ambulance for every 100,000 people.
That's really hard to wrap your head around. I mean, in cities, it's more like one ambulance for every 30,000 people. It's a massive difference.
It is. And as if that wasn't enough, you also have the geographic challenges. I mean, imagine trying to get an ambulance to someone who lives down a long, winding dirt road, especially if the weather's bad. It's not uncommon for rural villages to lack reliable all-weather road access. In fact, about 30% of them do.
Wow. So even if an ambulance is available, it might not be able to reach the person in need quickly.
Right. And these aren't just statistics. These are real people, real communities facing these challenges every single day.
So that's where this emergency transportation network comes in. It's trying to bridge those gaps.
Exactly. And the story behind it is pretty fascinating. It actually has roots in a company called EON Reality, and specifically their AI-powered entrepreneur guide.
Now that's interesting. I know a bit about EON Reality. They're a big player in the XR space, but I wouldn't have guessed they'd be involved in something like this.
It's not what you'd typically expect, right? This AI platform is more about business development, helping entrepreneurs create and launch new ventures.
So how did this platform lead to the emergency transportation network?
Well, it seems someone, an entrepreneur, had this passion for improving emergency care, specifically in rural communities. And they used the AI-powered entrepreneur guide to structure their idea, turn it into a solid plan. And the key concept they came up with is pretty brilliant. Okay, so picture this. Instead of relying solely on traditional ambulances and emergency services, which, as we've seen, can be stretched thin in rural areas, they created a network. And this network links up patients with local transportation providers, community members trained as first responders, and nearby healthcare facilities.
I see. So it's about using what's already there in the community, but in a more organized and efficient way.
Exactly. Mobilizing existing resources to respond to emergencies more effectively. You could almost call it democratizing emergency care, because it's bringing the community into the solution.
I love that phrase, democratizing emergency care. That really captures the spirit of this initiative. But let's get into the nuts and bolts. How does this all actually work in practice? What are the key features that make it tick?
Sure. So one of the first things you have to consider in rural areas is communication. You can't assume everyone has access to the same technology or even a stable internet connection.
Right.
So they built the network to be accessible through a variety of channels. You can reach them through phone calls, a mobile app, SMS text messages, and even radio communication.
That's smart. So no matter where you are or what technology you have access to, there's a way to connect with the network.
Exactly. So let's say someone calls for help, right? They report an emergency. Now what?
What happens next?
Well, here's where things get really interesting. They have this dynamic dispatching system. It takes the caller's location and the type of emergency, and it instantly figures out who's best equipped to respond and who's closest. It could be a community member with first responder training who lives just down the road, or a transportation provider who's already out on the road.
So it's like a really sophisticated routing system, but for emergency response. It's considering not just distance, but also the specific skills needed and who's available in real time.
Precisely. And here's another key feature. To ensure a basic level of care, even from non-medical professionals, they've developed standardized medical protocols.
Oh, I see. So if it's a common emergency, like a broken bone or a severe cut, there are step-by-step instructions that community responders can follow.
Exactly. It gives them the guidance they need to provide appropriate care, even before an ambulance or paramedics arrive. It helps ensure that initial response is as effective as possible.
That makes sense. So they're getting crucial help while they wait for the professionals.
Right. And then you've got the GPS navigation piece, which is vital in rural areas. The system guides the responder directly to the patient, no matter how remote the location, and then to the most appropriate medical facility.
That's so important, especially if the responder isn't familiar with the area.
Absolutely. And there's one more piece that I think is particularly innovative. Telemedicine.
Telemedicine. How does that fit into all of this?
Well, imagine this. While the patient is being transported, the local responder can use their phone or a tablet to connect with a doctor or nurse via video.
So they're getting real-time medical guidance, even during transport.
Exactly. The doctor can assess the situation remotely, give instructions, maybe even help with some preliminary treatments. It's bringing medical expertise directly to the patient, regardless of where they are.
It's like bridging that geographical gap with technology. It's really remarkable. And it all stemmed from, someone using this AI-powered entrepreneur guide.
It really did. And that's what's so interesting to me. This wasn't just a random idea that popped into someone's head. It was a systematic process of identifying a need, analyzing the problem, and developing a targeted solution.
The sources we have give some insights into that process, right? They actually break down some of the steps that the entrepreneur went through.
I do.
And one of the first things was assessing alignment, How well does this idea fit with existing structures like healthcare systems, transportation services, and of course, emergency response protocols?
Yeah, that's crucial. You have to make sure the solution actually fits into the real world. And in this case, they scored really high, like a 9 out of 10, for alignment with all those sectors.
So they were really thinking about how to make this work within the existing framework. And then there's the part about identifying the gaps, the specific challenges they wanted to address.
Right. And we've already talked about those. The long response times, the lack of ambulances in rural areas, the road access issues. But the key is to systematically document and analyze those challenges.
And after that, it's about validating the market, right? Is there a real need for this solution? Can it actually be built? And are there ways to make it financially sustainable?
That's the make or break point for any new venture.
And according to the sources, they scored a perfect 10 out of 10 for market demand.
Which makes perfect sense.
Yeah.
I mean, the need is clearly there. It's a life-saving service.
Right. On the technical feasibility side, they got a 7 out of 10. It's achievable, but there are technical hurdles to overcome.
Yeah, and that probably relates to the challenges of adapting technology for diverse rural environments, areas with limited connectivity and varying levels of infrastructure.
Makes sense. And then, of course, there's the financial aspect. They had to explore different revenue models to ensure the network's long-term sustainability.
Right. And that's where you see the clever blending of different approaches. They're looking at government contracts, so partnering with local or regional authorities. They've got community subscription plans, so entire villages can chip in to support the service. And they're exploring pay-per-use options that could work with existing insurance plans.
That's smart. They're diversifying their funding sources to make sure the network can stay afloat. And then finally, the platform helped them bring all of this together to actually build the integrated solution, combining communication, dispatching, medical protocols, all those things into a functional system.
Exactly. It's about providing a framework, a roadmap for taking the identified need and transforming it into a real-world solution.
So it's clear that this network has the potential to benefit a lot of people. I mean, obviously the patients themselves, the ones who need emergency care.
Absolutely. And the benefits for them are huge. You've got quicker access to help, those dramatically faster response times, the potential to save lives by getting people the care they need within that golden hour.
Right. And it's not just limited to medical emergencies, right? It could be anything from accidents to, natural disasters, situations where people need immediate assistance.
Absolutely.
But it's also about the people who are part of the network, the ones who are providing the transportation and the initial medical response. What's in it for them?
Well, first and foremost, they get valuable training. They're equipped with the skills to handle emergency situations. They get to make a real difference in their community. Be the person who steps up when someone needs help.
That's a powerful motivator. And there can be financial benefits as well, right?
Right. You can provide a supplemental income, especially for folks in rural areas where economic opportunities might be limited. Plus, they get the support of the network, GPS navigation, real-time medical guidance. It takes a lot of the guesswork out of a very stressful situation.
And it's not just the patients and the responders who benefit. The healthcare facilities themselves are also in a better position, right?
Absolutely. The network gives them advance notice when a patient is on their way.
So they can be prepared, have the right staff and equipment ready.
Exactly. And it extends their reach into more remote areas so they can potentially serve more people. It's a win-win situation.
Now, one of the big questions with any initiative like this is sustainability. Can it be maintained over the long term? And it sounds like they've given a lot of thought to that.
They have. They've got a really well-thought-out hybrid revenue model. They're not putting all their eggs in one basket. It's a mix of government contracts, community subscriptions, pay-per-use systems that can be lived with insurance, and even seeking out impact investments and philanthropic support.
So it's a multi-pronged approach to make sure the network has the resources it needs to keep going. And then there's the tech side of things. The information we have highlights some pretty cool innovations that are specifically tailored for rural environments.
Yeah, the technology is a huge part of what makes this network so effective. We already talked about the multi-modal communication system, but they've gone even further. They've got these algorithms that help triage emergencies based on severity so the most urgent cases get prioritized.
That makes sense.
And they have digital protocols that guide the first responders through each step of the process, what to do, what to look for, how to stabilize the patient. And because internet access can be unreliable in rural areas, they've developed offline navigation systems.
That's crucial. So even if the responder loses their connection, they can still find their way.
Exactly. And they've built the system to operate on extremely low bandwidth, so it can function even with a weak internet signal.
That's impressive. What else stands out to you in terms of the technology?
Well, they've also been very mindful of accessibility. They've got multi-language interfaces, so it can be used by people who speak different languages.
Yeah.
And they've incorporated voice-based interactions, which can be really helpful in stressful situations or for people who might not be able to read or write well.
So they're really thinking about inclusivity, making sure the network is accessible to as many people as possible. And it sounds like they're already putting this all into practice.
They are. They've launched a pilot program in a few districts with the goal of onboarding 50 transportation providers and serving about 100 villages. The main goal is to see if they can achieve that 40% reduction in response times.
That's a really ambitious target, but it's exciting to see them aiming high. And what are the plans for the future?
Well, if the pilot goes well, which everyone seems to be expecting, they plan to scale up pretty rapidly over the next 3 years. They want to expand to more districts, recruit more providers in villages, and start implementing those community subscription plans more widely.
So they're not just thinking about the short term. They've got a long-term vision for making this network a permanent fixture in rural communities.
Absolutely.
The information we have includes a quote from Dan Lajerskar, the chairman of EON Reality, about this whole initiative. What was his take on it?
He's really enthusiastic about it. He sees this as a prime example of how the AI-powered entrepreneur guide can be used to create tangible solutions to real-world problems. He specifically mentioned how this network has the potential to drastically improve survival rates in areas where access to emergency services is limited. He believes it's a model that can be replicated and adapted for other communities facing similar challenges.
So he's not just talking about this one specific initiative. He sees this as a broader model for empowering communities.
Exactly. And that's what's so exciting about this whole story. It's not just about ambulances and response times. It's about a community coming together to take care of its own, using technology in a really smart and impactful way.
Absolutely. And for all of us listening, it's a chance to step back and think about the potential in our own communities. What are the untapped resources, the skills, the local knowledge that could be mobilized to address the challenges we face?
That's the big question, isn't it? And the Emergency Transportation Network shows us that it's possible. It's about thinking outside the box, being creative, and finding innovative ways to leverage what we already have.
I couldn't agree more. This is one of those stories that leaves you feeling hopeful, like real progress is being made.
It really does.
If you're interested in learning more about this specific initiative, you can look up the Emergency Transportation Network Entrepreneurial Journey Summary, and I think they also have some information on their EON XR spoken blog.
It's well worth checking out.
It really is. Well, that's all the time we have for today, but this conversation is just the beginning.
Let's keep exploring these ideas and see what we can create together.
I'm all for that. Thanks for joining me.
Thanks for having me. It was a great discussion.
It really was.